Good day, everybody. I'm Dr. Darrell Wolfe, and welcome to another Doc of Detox show. And what we're going to be doing today is we're going to show you, okay? Yes, there's lots of therapies out there, okay? But as far as I'm concerned, if you don't know how to train yourself and then be able to treat your family, then what do you think?
Well, I think that we really need to learn to treat ourselves, treat our families and friends so that we can bring health home.
Yes. Does everybody understand that in the word treatment, the first word is treat? Okay. How many people are out there getting treatments and it's no bloody treat?
There's a lot.
Ask yourself that. Okay. Ask yourself, if it's a treat, then that means that the money you spend, the time you spend, is going to be beneficial. And if you're continually going for that treatment, then is it a treat? Is it actually taking root? Is it actually making a difference? And listen, I'm not telling you not to go for treatments, but the reality is unless you get trained to look after your body, then everybody else is going to be in charge of it. And I'll tell you something right now. I will never let anybody in charge of my body. And the thing is you always need to ask why. Why this? Why that? You need to always, too, look at the therapist that you're dealing with and look at the shape of their mind and look at the shape of their body and then look at the therapy and see, does the therapy really hold? Is it actually reversing the aging process? Is it actually giving you more mobility, more energy, more elasticity, more strength? Is it making you feel more youthful? Or is it just another Band-Aid? So these are the questions, and unless you're going to start asking these questions, you're going to get into trouble.
Well, and you know, Darrell, too, what's so important about the Wolfe Deep Tissue work and the non-surgical is that you learn to do this on yourself. And if you incorporate this with your family, just think of the love that goes into the work that you do that's transferred onto your loved ones and friends. So we'll talk a little bit more about the courses coming up in Florida.
Yeah, we'll talk about the course in Florida and the personal treatment and trainings we
Yeah.
do here, and the personal treatment trainings we do that we go to people's homes and we teach families and couples. And we'll also talk about how we have certification to go, where we go to another country, and if there's more than six therapists that want to be certified in our techniques, we'll show up and we'll help you to grow up to that real practitioner that you really want to be. So what we're going to be hearing, what we're talking about today is why you came on this show. And I want to show you something. You know, how many people do you know? Well, just take a look at it. How many people do you know are limping? How many people do you know are stiff and they got to get moving in the morning because it's either their ankle, their knee, or their hip that they've got to get going, okay? And that's the way it is. Now, understand something. Whether you want to believe this or not, out in the world of healthcare, it's made to look like it's just a mystery. Nobody can figure this out. You know, all the greatest minds in the world have come together and it's still a big mystery. Well, it's not. Inflammation and scar tissue will ravage your whole body. And when it starts, it grows like weeds, it grows like a spider web. And just like how the spider catches the fly, what happens is that you've got all the different scar tissue throughout your body. And what it's doing is it's actually creating what we would call little beaver dams. So it's backing up waste. And it doesn't allow the oxygen flow, doesn't allow the nutrition in, the waste out. And guess what else it's doing? It's causing inflammatory problems, which causes too much calcium to the area, which then it actually, guess what it does? It walls your mitochondria, and your mitochondria don't work properly. And your mitochondria create the ATP that create the energy. So between the crystallization, the calcification, the scar tissue formation, your energy flow, your lymph flow, your blood flow is being choked. And now, if you go to a practitioner and that practitioner treats you, and that practitioner it doesn't know how to totally reverse and get rid of the scar tissue and return that beautiful connective tissue, why are you going? Let me tell you something. Every therapy has its place, but how many professional therapists out there do not deal with scar tissue, but they can help to relieve your pain, but how long does it last? And I don't want to pick on any segment or any group because it's not about that. It's about you taking the power to actually be able to work on yourself and your family. And understand something. I would like for whoever's watching today to call me up and challenge me on what type of a physical problem in the human body that we would need a professional therapist that we could not do ourselves. So there's not everybody's going to want to take on this personal take action. But remember something, it's your body. It was created for you, and you're going to just go for a treatment once a week, and that treatment might last a half an hour to an hour, or you might go once a month, and you're not going to give any more thought to your body than that. So, what we have done in the natural health field and in the medical field is we've taught everybody out there, don't touch yourself. It's too dangerous. You might wreck your spine. You could break your neck. Oh my gosh. What do you think you're going to do? I'm going to tell you something. You're going to hurt a lot more before you ever hurt yourself. I'll tell you, the danger is not you. The danger is out there.
And the other thing too, by doing the Wolfe deep tissue work or the non-surgical, you really don't know what normal is. I mean, well, normal in the sense of what society is, but what truly is your body. I mean, I've been doing this work for a while, and I am just amazed as my mobility and my movement, my flexibility, and I'm a chronologically mature citizen. So, hey, I feel great. I feel better now than I did 5 years ago.
Yeah. So we're going to get right to doing the knee. That's why we're here today. So we're not going to keep you waiting forever in a day. But I think it's really important. Does anybody notice how I repeat myself like continually? Mm-hmm. And I'm going to continue to repeat myself until you get this, that you are the hidden, unseen practitioner that you've been looking for. So anyway, so yesterday you had Abby do pelvic work on you.
Oh, yeah.
And she said to me, you know what Suzanne said to me? She said, you know what? I'm going to get the work done. And I said, Abby, I want you only to focus on her pelvis because you know what? And Suzanne, I've already had a lot of work, Darrell. So I'm going to get Abby to just work on my pelvis. Then she's going to work on my back. Then she's going to work on my hips. And I go, Abby, you spend an hour today on her pelvis. No, Darrell, you don't understand. I said, Abby, I don't want you coming off of her pelvis. I want you just to, the pelvis, guys. It's the groinal area, right? And I'll tell you something. How did you do, girl?
Oh my God. I mean, it was amazing, absolutely amazing. And I just have to say this. I mean, because women out there with incontinence and not noticing that your urine flow, my urine flow was even different. I mean, the freedom that I feel in my root chakra, I hope I can say that, or in the groin area, it's just unbelievable. Not only that, but I also noticed my gait and how free my legs were moving. And what was also very interesting, because I've had some surgeries in the area, that the scar tissue just doesn't stay in one place. As Darrell said, it's like a spider web, that it was actually wrapped around my greater trochanter, which is right here in the hip here. And when she went in there, I felt it, but I feel free. It's amazing work. And again, I've had body work for over like 30 years from different type, from neuromuscular therapy to structural work like Rolfing and things like that. And this really gets to the cause. It really gets to the root problem of it all. And then go to the other therapies and to keep maintaining.
So it's not how much you do, guys. When you get a massage and they do a full body massage, it feels good. Mm-hmm. And you release healing hormones. Yeah. And it makes you feel loved. But is it therapeutic? Only on that level. Only on that level.
Right. It's what do you want out of your body?
Yeah.
That's what you need to ask yourself.
And if you just want to have somebody to ease you and make you feel loved and just move the lymph a little bit and increase the circulation, Great. That's fine. But it's not going to reverse any chronic condition, okay? Just like drugs don't reverse chronic conditions. So you have to understand that sometimes you've got to go in there and you've got to do a little bit of tough love. So we actually don't tear anything. We just pull the fibers apart that are stuck together because you're stuck. You're stuck emotionally, so you get stuck physically. And everywhere in the human body, when I teach a course, do I teach everybody that every part in the body and every muscle in the body has a different frequency? Did you get that? This is scientifically documented. And every frequency is attached to a different emotion. So continually have the same emotion, and then you'll have a knee pain or a low back pain. Like, the other day, like it's been bothering me for a while. I'm like the shoemaker who doesn't have shoes, right? My right side of my body, I have problem with it because physically I fell off a roof when I was younger. So that was like when I was 12 years old. But it still shows itself when I overwork and I don't get the therapy. But now I'm getting from my therapist, I'm getting 15 to 20 minutes every day. So, and what they're doing is when it's called a sacroiliac, and it's back here. If you feel back, and there's a little bone back here. And I said I wanted my low back done. So the therapist said, okay, so what do you want me to do? The low back, the sacrum, the coccyx, and your hip? And I said, no, just go around the sacroiliac, which with tuberosity, which is only this big. And I said, stay there for 20 minutes. So meanwhile, I was already having a bit of sciatica pain come down and actually into my ankle, right? So, sometimes we know better, but we just don't do better. So that would be me. Okay. So anyways, so I have Genevieve, and what she does is she goes in and she just works on this area, no bigger than this. And guess what? So 15 minutes later, my whole back is loose. Okay. There's no pain in my hip. There's no pain in my knee. There's no pain coming down my ankle. All right. So that's how that works. So now I do my own knee. So you know what? Even if, like I was joking the other day that, if I get up at nighttime and I go to the bathroom, I might just sit there and do some work on my knee. I said, if you're on the bus, you can do work on your knee. Understand something. If you want to grab me the beef jerky, okay? Understand that when it comes to the ankle and the knee, they're very easy to repair. I'll tell you right now, we have countless people on our website at itioh.com. Look at the testimonials. They were supposed to go for knee surgery or ankle surgery, okay, or hip surgery, and they never go. We have a money-back guarantee that the first treatment we do, it will do more than all the other treatments you've ever had, or you don't have to pay us. Now, I don't do that because I'm trying to line up a whole bunch of people outside the door. I'm trying to tell people that it's not that difficult, and that even the practitioners that are out there treating people have been mistreated in their information. So, and you actually have this, beef jerky, okay? Yeah, hi. I wouldn't eat this stuff, but you know what? This is what's in your knees, right? This is what's in your knees. And that's why you say to Grandpa, hey, Grandpa, you look like you're in pain. He says, I don't feel a thing, because the beef jerky is wrapped all around the nerves that used to cause him lots of pain. And now the nerves aren't dead. People say they're dead, but they're not dead. They're just being smothered. They're not allowed to do their job. And that's what neuritis is actually inflammation from the scar tissue until it gets rid of it. Okay, like neuralgia pain in your legs or anywhere else is where the scar tissue has just coming in and it's suffocating the area. And you're not going to get rid of it until you get rid of that scar tissue. And then you're not going to get rid of the scar tissue until you find out what are the inflammatory foods, what are the inflammatory people in your life, and what are the inflammatory drinks and the inflammatory addictions you have. And you'll always be able to tell what a person's really like by what they do with their spare time. Think about that. Okay, so
can I just say, I'd like to say something about this beef jerky, is that when I first started doing the Wolfe Deep Tissue work, and I could feel the clump of the beef turkey here. And as or jerky, I keep saying turkey, but anyhow, as I continued working it, you could feel the fibers just break away and then start breaking down. It's really fascinating.
Break away from each other. So what happens is all your muscle tissue in your whole body, and you know what? You're basically bone, muscle, water. That's it. Bone, muscle, water. So what's happening to the muscle? Well, it's getting dehydrated because you're fight, flight all the time and stressing out, which is causing your cortisol and your adrenaline to keep pumping into your body, which creates acidity, which then pulls on calcium from your bones. And that's why you get these calcium deposits throughout the body. That's why you get the osteoporosis so bad. Oh, and just so everybody, I just thought I'd lay this on everyone. Within 3 to 4 weeks, I will have a calcium that is beyond anything on the planet. It can take an 80-year-old person and totally reverse their osteoporosis. You heard what I said. It can help to get rid of the calcium that's wrapped up around the mitochondria, calcium deposits in the breast, arthritis. Do I need to keep going? Calcium is used for over, it's responsible for over 100 diseases. And the reason why I've never sold calcium before. Why? Because it's not absorbed. This is the first calcium that is 99.9% absorbed and takes no ATP, otherwise no energy to be taken up by the body.
Wow,
it's the biggest breakthrough in calcium in history. And I will have that product on my website in 4 weeks, okay? All right.
Very cool.
So let's get back to this. Go ahead.
You need us, and we're going to show you that.
That's right. Can I have the rope over there? So I want everybody to understand something. When I go to bend my leg like this and I can't bend it, or when I can't bend down, okay, when I don't have range of motion in my ankle anymore, it's because it's crystallization, calcium, and scar tissue. So here's what's happening is you're actually because of the inflammation. You're actually, because when you have inflammation, your body overreacts because you overreacted and you overate or overdrank or over emotionally abused yourself and you don't even know you're doing it. And that creates the inflammation, which causes lots of fibrin to be sent to wherever the inflammation is. And that will pile up in that area. And that's what we call a knot. Oh my God, I feel like I got a knot here. Can you just work that out for me? And you know, you can get somebody to work it out, but if they don't use their elbow and use Wolfe Deep Tissue, and when people say, hey, I go for Wolfe Deep Tissue, no, you don't. You don't go for Wolfe Deep Tissue. Okay? I know somebody who does it, or I do deep tissue. No, they don't. And when I say this, I mean that in the best way. So we're not massage, and we're beyond any deep tissue that you've ever seen with this technique. Because if you're not pulling the fibers apart. So anyway, so when the fibrin goes in, it'll keep piling up on a certain area. So guess what? I'm going to make this really quick. So what you start with is an image in your mind. Then you have a thought. With the thought, you have a feeling. With the feeling, that creates a frequency, doesn't it? You're either up or you're down. And that frequency is actually going to release hormones and chemicals in your body. Are they happy or are they mad, sad, bad? Okay, so depending on that, and the longer and stronger you do this, okay, that is actually, what did Einstein say? E equals mc squared. So energy equals mass. So your energy, because you are not the master of your emotions, is out of control. So now you repeat it enough, and guess what? Just like I said before, two people can come together and create a baby, but you all by yourself can create a tumor, a fibroid, arthritis, cancer, diabetes. You can create, and whatever the emotion is that you're replaying continually, okay, whether it's fear, jealousy, lack, all of these things, and when they come together, they create what we call the master frequency. We'll create the master disease or the master healing. Which one do you want? So now you get this knot, and what happens is, it's not quite like that, but the knot has tons of fibers on it. And the body puts all this fibrin on it, just slaps it on fast because it wants to wall off so that the inflammation doesn't spread throughout your body. So it just wants to keep it in the knee joint or wherever it is because it's actually destroying your tissue. And understand that pain is actually your friend. It says, honey, you're off track. Can you get back on track? But you don't realize you're supposed to be responsible for your own body and you don't know how to be responsible for your own body. So then you go to somebody who pretends they're responsible for your body. Okay, so now how are we going to untie this? Well, what happens is, first you have the blood flow, lymph flow going through here, then it sticks together. The fibers are now tight. So now you can go from actually something that big of a muscle, that thick, to that thin or thinner, because it's dehydrated now and it's all compacted. That's why you can't move and you're not flexible. So what we go do is we go in there, we close our eyes, we get connected to the lion heart breathing, 6 seconds in, 7 seconds out, and then we actually take our conscious mind, okay, and we put it in our elbow. And we get connected to our breath, and we feel these tendons, ligaments, and muscles. And we can tell the difference between a calcium deposit, a crystallization, or just matted scar tissue. And understand something. I know you don't want to believe this, but your 12-year-old could learn this, okay? All right? Now, so we're going to talk about the knee. Was there something you'd like to add, though?
Well, I just kind of want to show something here.
Okay.
I mean, because so like doing the Wolfe Deep Tissue work, as we go here and we start breaking up, you're going to see this unwinding, getting looser and looser, and then you go back to your natural state.
That's right. So now you have that. You have that length to stretch out your leg completely. Look bring me in somebody that is limping. Bring me in somebody with a cane or a walker.
Wheelchair.
Or a wheelchair, long as the spine's not cut and they haven't been in the wheelchair for 10 years and they have no muscle. And guess what? They don't have muscle. They don't have muscle in their brain anymore because now the wheelchair is an appendage. Do you get what I said? So no way am I going to cut that appendage away from them because that's their best friend. Who are they with the most? The wheelchair. Not with their family, the wheelchair. Okay? Who are you with the most? You're with your walker. Okay? And then if you live in fear, I'm not going to give up my walker. What if I fall? Well, I don't know. Did you ever see anybody? What happens? You go from a cane to a walker to a wheelchair to the nursing home, don't you? Right. So where's your courage? Well, you can't get the courage until you have the right information. How do you find that? Well, that's being hidden from you. We won't get into that. All right. So what we're going to do is, first of all, can I have a skin brush? And can I have the Epsom salt glow? First of all, if you've got a joint problem or a muscle problem anywhere in the body, okay, anywhere in the body, we're going to skin brush it, right? You want to grab one for yourself?
Oh, I love it.
Okay.
I do this twice a day.
So yeah, we're not going to rush this, guys, because there's some of you that will say, hey, he's boring me or he's taking way too long. But that's because this isn't a priority. When your health becomes a priority, I won't be taking too long because I'm actually giving you everything that I can. So understand that. You'll always know how much you love yourself and how important you are to yourself when you become the priority. And guess what? If you're not the priority, no guilt here, okay? You've just been sucker punched. You've been told that everybody else is more important than you, okay? But how far is that going to get you? Okay, so I try to at least once every week, okay? But I try to do it once every 3 days.
Oh wow, I could be an extremist. I do this like once or twice a day.
Yeah, but guess what?
Well, but that I'm in Florida, and
no, it's not that. It's a time thing, right?
Well, yeah, but
See, it's a time thing, but at least we're doing it, right?
Yeah,
and the thing
right
is
before your
I'm
shower.
just jealous of her, so I'm trying right now. I'm just trying to make her feel bad for saying that. Okay?
I don't feel bad.
Okay, all right. So the reality is that okay, I do it maybe every 3 days, but when I do it for a long time, an extensive time, and I'm doing it in a circular motion towards my heart, but I'm really in there. Like when I get done, my skin looks red. It's called hyperemia. I brought all this blood flow to the surface. Your skin is your largest detox organ in the body, and it's got to breathe. You know, you people that have the chicken skin, okay? And you know the people that have all that dust around the house? Well, that dust is your skin piling up, okay, on you. And if you go to a window where the sun's coming in and start skin brushing, and you know what? You're going to think it's winter, even if you're in Florida, because it's going to be snowing. And that's the skin that shouldn't be on you. So we do want a skin brush, and you want to get a natural bristle brush. Bernard Jensen makes a brush, and that's the one we sell. And this is the best one. And it's the same kind of brush that you would use on the horse. Okay?
Yeah.
We used to use this on the horse. Okay? And or if you were in an orphanage and they made you scrub the floor.
Yeah, well, and the other thing, look, it's got a handle on it, so you can go on your back. It makes it easier, and also back here.
And
so
I know we're off track.
wonderful.
Yeah, and I know we're off track a little bit. And
you
I just
do
cut you
that.
off. I didn't mean to do that.
That's
Go
right.
ahead.
No, I just wanted to share that with you because getting the back is kind of hard. But do this before your shower. Some people do it in the shower, but if you do it before your shower,
It's called
awesome.
dry skin brushing for a reason.
Yeah.
If you do it in your shower, it'll feel like a massage, but now you're not going to get the dead skin particles off and create that hyperemia to create new skin. You want beautiful skin? I'm going to tell you something. You can spend all the money you want on skincare products and all this BS that they got. I'm going to show you the oils and the creams that we use, okay? But I even do my face. I'm just going to show you for a second here. You don't do this. This is how hard I go when I do my face. Look, now this is a really rough brush, and I'll do that. Why? Because when I do that, start off easier. This is not about abuse, but I can go harder, and I've got very soft skin. I have really nice skin, and I mean it in that way because if you've got healthy skin, you've got nice skin. And I'll even go on my face. Look at this. And then I'll even do in my hair like this. You see? Mm-hmm. It's not scrubbing my head off because I keep it steady in here. And I go like this, and this will help hair growth, help against migraine headaches, tension, things of that nature. But we're talking mainly about the knee today. I know, but we're trying to be thorough here, all right?
we get off track sometimes, but don't talk about the eyes.
Yeah.
Remember that?
Yeah, the occiput, and this is called the upper eyes of the body, and that's where you see where your occiput is. There's 2 bumps at the back of your head. Really skin brush the heck out of those, and you will put yourself into euphoric bliss.
Oh, it's
because
wonderful.
that is the holy grail of your neck and your upper body. And you could even have spasms in your neck. And also, you want to go in here, in the back here, where these eyes are. Because guess what? You want to open up the vagus nerve. Do you know why some people can't get out of fight, flight, and fright? Because they're actually stuck in a sympathetic state because the actual vagus nerve is now frozen because of crystallization and scar tissue. So you want to really loosen this area up.
On both sides.
Yeah. And then I'll do my whole face, and I'm not gentle on it. You know when people say be gentle on your face? I'm not gentle on it. And in women, you need to do your breasts, you need to do your groin, you know,
Under the pits.
under the armpits, but be
always
gentle
going
under there.
towards the breast like this.
Yeah.
Because of the lymph system.
And if you've got fat in your under your armpits, that's congested lymph, and that's the biggest answer to cancer right there. You get that moving, okay? So anyways, so you want a skin brush, you want to make sure it's dry, and you know what? If you can't go to sleep at night and you skin brush, and then you actually do the belly button therapy and you do the Lionheart breath, I don't care if you've been taking sleep medication forever. You can see this on our website at Belly Button Therapy. We'll talk about this later.
Okay.
I don't care if you can't sleep at night. If you do skin brushing, the belly button therapy, and you do the Lionheart breath, put your hands on your heart and just thank the Creator for giving you everything you've ever wanted. And just picturing your day, how it's going to go tomorrow. And just keep focused on that. And I swear, you're going to go to sleep. Okay, and just practice that. So now, we talked about the skin brush. So you want to skin brush that area of your body, whether it's like so. If I had a bad knee, every day before I got started, guess what I would do? I would skin brush my knee instantaneously before I even got out of bed. I would do this. Why? Because I already know that I've got beef jerky in here. So I want to go in here and really get the blood flow, because guess what? The blood doesn't flow that good around the knee. So you want to go above it a little bit and around it. And I'm telling you, do it without skin brushing and then do it with skin brushing. And what'd that cost you? And you're going to find the difference is about 25 to 40% in the pain and also in the stiffness. Then what you want to do when you go to have your shower is you're going to use Epsom salts. Okay, you can get the Epsom salts from Costco, big container. So what we do is we'll fill this up with Epsom salts. And then what we do is we use structured water from this unit here. It's called a portable structured water unit. Put the structured water in, and why structured water? Well, guess what? Reverse osmosis, filtered, okay, bottled water, spring water that you buy, they're all scam. You heard what I said. They're scam, okay? Because they're not really doing what they should be, because the main key to any water on the planet is structuring, not alkalinity. Get rid of that one, okay? Water can even be slightly acidic, and it's still going to be way healthier than any alkaline water machine you're going to buy that drives the alkaline up, or that the water you have to buy, the high alkaline. If it's not structured, it's not getting into the cells, so who really cares, right? Okay, so we're going to structure the Epsom salts, and then we're going to put in here, we put in this one, Lemon Lift, and you can also we put in Muscle Restore, because we're trying to restore the joints. And these are essential oils that we carry, and I promise you, our essential oils are pure you can get, okay, on the market, and they'll be about 30 or 40% cheaper than the competition. So now we've done that, and what we're going to do when we go to the showers, we're going to sit on those little white stools, and we're going to go and scrub the leg, right, with the Epsom salts, essential oils, soaked in water, and scrub it really briskly. Scrub it. Oh my gosh. You know what you're going to do? You're going to go, I can't believe it. My knee problem is starting to go away. Between the skin brushing and doing this, it's starting to go away. Well, yeah. So listen, the door hinge is rusty, and so you're not going to lubricate it with any oil. You're just going to try to rip that sucker open, and you're going to rip it right off the hinge. Okay. Now, why would we go for surgery until we have exhausted everything else that is more loving to the body? Why would we take drugs until we have exhausted everything else that is more loving to the body? So now you've done this, okay? So now if you could pass me the DMSO and the Muscle Restore, Pain Away, and the Castor Oil, and the shot glass. Okay. So, and where's the moringa oil? Thank you. Mm-hmm. So here's moringa oil, and we have structured moringa oil. I would put moringa oil on here when I go to do my deep tissue. And would you like to add something to this?
Well, the salt glows are so wonderful. And the thing is, you just don't have to use it for pain. I mean, lavender is absolutely wonderful because it just kind of relaxes you. And I sometimes even take a little bit of that with the lavender, or sometimes even frankincense, and I'll do my face.
And guess what? when you're putting the essential oils in this Epsom salts, what is the main mineral in Epsom salts?
Oh, magnesium.
Magnesium. What does magnesium do? It actually opens up the muscle fibers. It actually emotionally and physically relaxes you because every mineral has a frequency. Whoa. Relaxation, calm, and healing. Okay? So it'll help to lengthen and strengthen. So when you go in here and you're stimulating with this, you're not just getting the blood flow going, you're getting the essential oils, which essential oils are the highest vibrational nutrient on the planet, along with the magnesium, and driving it into the area. So what if you did that to your whole body and you couldn't sleep, or you just had a traumatic, stressful event in your family? Well, guess what? Can you be selfish enough, if you did, to skin brush and then go do a salt glow on your whole body, and then connect to your breath and do maybe the belly button therapy? Guess what? Sure, the trauma's still happening, but it's not ripping and tearing your body apart. Do you know that every time somebody gets sick in a family, 1 or 2 people get the same sickness within 1 or 2 years? Tell me I'm wrong. Check it out. Or it runs through our family. No. Your emotional crises run through your family, and emotions have frequency. And your superpower or your curse on this planet is emotions.
Yeah, and the other thing too is like the orange burst. That is awesome. It just lifts you up. So maybe your energy might be down just a little bit. I have little containers of my salt glows with different essential oils in it.
Because orange burst is for the breasts.
Yeah, and that
not just for the breasts, but
yeah, but then the other thing too, because it's structured, because it's like 1 or 2 molecules, I believe, Darrell, that the water when it goes through the structure.
Well, so what's happening is in all other water, I don't care what you're talking about, 25 to 3,000 molecules in a water droplet, and when you structure it with this device, it brings it down to 6. And because it's only 6, when the water comes near the actual cell, there's a frequency. And what it does, that frequency actually will go to the water molecule, and it causes it to unravel and become straight like a choo-choo train and go straight into the cell.
So when you add your essential oils to it, I mean, it just works fabulously. And the other thing too, try this at home. Take some of the magnesium, put your favorite essential oil in, using the structured water, of course, and wash your hair. Let it sit and give your scalp a wonderful treatment. It's awesome.
Yeah. These are the things that heal us. And people are not going to tell you about this. You're not going to get this on a commercial on TV. You're not going to get this from your doctor because, believe it or not, we're going to show you enough techniques that 95% of your pain, okay, if you watch my shows and stay with us, you're in the driver's seat. You are no longer on the pain train.
Yeah, and it's so interesting because there's so much information out there, and everybody has their own little walk of life. But try these things, and it will resonate with you right here in the heart. That's where it's at.
Learn to play with you. Learn to love you.
The inner child.
If you could learn that, your friends call you up and you go, hey, they want to come out. You want to come out there? No, I am just here having so much fun with myself.
And what are you doing? They want me to put it over here.
All right. Okay. All right. Okay. So let's start. Okay. So what we've done is we're going to put our moringa oil on. Okay. Because it's really healing oil. If you don't have that, you can use coconut oil.
Coconut oil.
Okay. And those are the best oils to use. Okay. The moringa oil has more grab though. It has a little bit more grab, so I like using it. So if you want to work with me and do this, everybody, get yourself comfortable. You can be on the floor or put it up on a chair. Have 2 chairs, put a chair here and a chair there, or do it on the floor.
Yeah, another thing I'd like to say, I'm dominant right-handed, but I've learned to use my left hand too. So experiment what's going to be good for you. Now, using your left hand, because I'm still a little bit awkward with it, but I still work with it because my body needs to be comfortable when I work on myself. So I might be like this and I feel, well, maybe this is more comfortable. So play around with it because you're limited by one thing, and that's here, the mind. So just have fun with this.
Yeah. Have fun with it. Have fun with yourself. It's about that. It's all about that.
Yeah.
It's all about happy.
Yeah.
Okay. So let me just angle. Omi, that's a good angle? Yes. Okay, thank you. All right. So what we're going to do is we're going to use our elbow. Okay. And here's your kneecap. So at the kneecap, what I want you to do is, I know you're not going to get this right away, but we're going to show you something. And I know this might be hard for you to believe, but give me somebody that has a terrible knee, like really bad knee, and they've had it for 10 years, and give me 1/2 hour to 40 minutes just on this knee, and I will show you at least a 60 to maybe a 95% turnaround. Am I right or wrong?
Yep.
Okay.
I've seen
How's
it.
that? Is that enough? Is that enough? Is that good
Yes.
enough? Okay, so I just want you to understand that you've been sold something. Okay, so now, so we've got the kneecap here. So what we're going to do, we put our hand like this. This is our guard to keep our elbow within it, so it's not flopping all over the place. When I bring my hand onto my knee, I'm going to pull down. I'm going to pull the skin down to make it more taut. Okay, so hand on knee, pull down, and then I'm going to come to the top edge of your kneecap. So it's right here. So we're going to come right to the top. And then I want you to just use that very little tip on your elbow. And I want you to close your eyes and I want you to breathe with me. I'm going to close my eyes too. Okay? We'll do this together. And, but when you close your eyes, you know what they say. The best therapist is blind and out of their mind. Do you understand? And that would be me. Okay?
Yes.
Yeah, you should see the stuff I lose. Right? Am I
Right.
right, Omi?
Yeah.
I can't even find my phone. You know?
Neither can I.
Okay, all right. Okay, so we're going to come to the top of the kneecap. And what you're going to do is I want you to pretend this is a windshield wiper. So you're going to go there. You're going to go off to the right. You're going to come down. And you're only going to do small movements. When you see my elbow moving, it's not sliding along the skin. And when I pull back with my elbow, I'm going in deep. And when I come forward, I'm taking the pressure off. Because, okay, so I'm going, look at this. I wish I should bring this down really low. Because you know why? I want to see if you can hear. And I've got, my knee's great, but I'll tell you, it was bugging me the other day. But I probably worked about, in the last week, probably an hour and a half on this knee because it was time for me to get my act together. You know, I'm 62 years old. I said I was 63 yesterday, but now I'm 62.
It changes a lot.
A lot, yeah. Well, I lie like everybody else. So I'm 62 years old, and I need to understand something, that I'm going to get older. That's it. But you know what? I'm going to be in control of it. I'm going to get older, but I'm going to have fun until I'm done. Okay? All right. So, okay, so I'm going to put this down as low as I can. You may not be able to pick it up, but I can hear it from here. Can you hear that? Mm-hmm. You hear the crunching?
I hear it.
Guess what? All of this, right from the top of the kneecap back, you need to work that far. But you're not going to slide the whole distance. I'm only going 1/16 of an inch. That's what you're hearing. And I'm just coming off the kneecap. And that's not supposed to be there. Listen, snap, crackle, pop is a cereal. It's not your body. And that's what happens is your body pops, like it rips. Okay, so here we go. So I'm coming right off the kneecap, and please don't anybody tell you that, you know, you better not do that. You might wreck your knee. What you are going to do when you break up the crystallization and the scar tissue is return the blood flow. It's going to feel a little tender. Listen, if you don't want to cause some slight bruising, don't even think you're ever going to get well. If you think you're going to take supplementation and exercise is going to get rid of this, you got another thing coming. Because the average healthy person is full of scar tissue when they're 62, when they're 42, when they're 32, when they're 22 even. I'm not going to be that way. When I'm 92, I'm not going to be that way.
Right. And the other thing too, you're going to get more blood flow. So
Yeah.
you may have some discomfort. You
Okay,
will have it.
so here we go. Listen. Now, is that hurting? No. Will it hurt most people? Well, emotionally, on a mentally level, it's going to hurt because nobody's ever done it before. Because you're going to put yourself into a what? A fear state. Oh my gosh. I've never worked on myself. And then use the elbow. And then he said, I actually have to create a little bit of pain. And then to bruise myself? Are you kidding?
I do it all the time.
Okay. All right. Yeah, but you're into that thing. Okay, so we're going to do it small. Like, you think my elbow's going an inch, don't you? It's not. I'm basically not sliding on the skin, and I'm actually just on top of the kneecap, and I'm going to clean that out. So, you know what? Do 20 minutes just in this area and get your groove. Look, most people are not going to do this, right? They'd rather pay to have somebody do it, and that's okay. But the reality is that if your therapist is not working on your scar tissue and he's just pushing a joint back into place, or he's trying to manipulate and massage the muscles, He's not pulling the fiber apart.
And you know, you can do this while you're watching TV.
Yeah. So anyways, so we're going to go in here and and then you see around the kneecap, I'm going to start working around the kneecap. I'm going to come here right to the side. Look. You don't hear as much there because I really worked on this side. I actually tore this when I was skiing, downhill skiing. And I got rid of the rest of it. I went in here and it was totally tender, and I'd say for 10 days. I took this all apart, right? And I don't mind. The physiotherapist or the chiropractor or the massage therapist or your doctor that tells you that is dangerous to do, I'd like them to call me on my show and we'll talk about it. Okay? All right. Putting it back up because I'm too loud?
Can't hear you very well otherwise.
Okay. All right.
That's good.
Okay. So we heard the crunching, so I think you've heard enough of that. But so now I'm going to come around the kneecap, and what I'm doing is try to picture this nut, and I'm going to go around the nut and get rid of the rust. I'm going to go around the nut and I'm going to clean the rust off and make it new again, okay? So that the body can lubricate it like oil around the nut, keep everything moving, right? So this is, you know what, it's like this, okay? Cars rust and people rot. So if I allow the scar tissue crystallization in here, then the blood flow is going to go down. I don't have the energy in here anymore. The tissue actually has to rot. Okay, people think that a diseased tissue is a diseased tissue. Do you know what it is? It's a rotting tissue. Disease means you're rotting in that area, in that organ, and that's because the vibration is down. So if your doctor said, "Well, you're rotting in that organ," well, dude, how do I get rid of that? Well, that's the thing. He can't tell you that because then he'd have to tell you how to get rid of it. All right, so now we're going to go around, and we're going to go all around the cap, and even now we're going to come into the front. So when we come into the front, we're going to do that as well. But now we're pulling up, but when we pull up, we're using the kneecap as a backboard, and we're going to actually break up, or pull apart, we should say. Pull apart the scar tissue, and we're going to break up the little crystals and the crunchies and even the arthritis, right?
Right, you got it.
Okay, so now, and then we're going to come around the side, and now when I'm not using my elbow anymore, I'm using the side of my epicondyle. It's that bump right here, you see? And I'm going to use the side of my epicondyle to come in around the knee. And I'm going to come all the way down here and work everywhere. Now, some of you may not be mobile enough, but you know what?
Bring your leg up like this.
You've got a family. No, I'm mobile. Yeah, but you could do that.
Well, no, I know you are, but I'm just showing other people out there that there's other ways that you can do this if you
watch.
can't.
You take this here and this here. You see?
Yeah.
So I want you to become creative, right? But I have that flexibility. This is just awkward for me. I don't need to do this. But somebody may need to do this, but then somebody with a stiff hip, if you can't do this, you need hip work now. Okay, and remember something. If you've got a knee problem and it lasts for more than 3 months, now you've got an ankle and a hip problem. Boom! Because you've thrown yourself out of alignment. Okay, so we're going to come around. And I'm going to work down. Listen, you ever notice there's no meat around here? There's just like little caves. They're called concave, okay? Or there's little bumps that stick out. Well, I'm going to go on top of all those bumps with my elbow and clear everything and loosen everything. I'm going to go in and clean everything. So if you close your eyes and you do the Lionheart breathing like, I got this. I got this. And just focus on it. And just kind of put your mind's eye down in your elbow and think about what you're feeling. And if you do that and you stay at peace with yourself, you will actually feel this stuff being pulled apart. So now I'm actually going to do this, right? Ready for this? So we went around. I'm going to come on top of the cap and hold the kneecap. Ooh, wait till you feel the crunchies in there, right? So let's get those. Mm-hmm. Okay, if you could hear that now. So we're going to there's lots of little crunchies in here, but you wait until you see the massive stuff that's just on the kneecap. So see, oh, wait a minute here. Do you see what we just did? We've just loosened the cap so that it could move. Do you think that if I loosened the cap, that might involve loosening up the whole knee? Come on, we got this. Okay. So and you can do this and put your leg down, like down on the table. Can they still see that, Omi?
Yep.
Okay. And then you can do this. Look. And just brace it with a pillow. And come in on the side. Look. And come up under. And remember, you're using the bones as a backboard to actually pull the fibers apart. That's the ticket. And when you're going away from the bones, you're going to pull the tissues away from the bone, because what happens is your tissue could be that thick. I'm exaggerating. And there's the bone, and it actually becomes this thin up against the bone and dried like beef jerky. And when you pull it away, instantaneously it comes back to connective tissue. People go, you know, I work on people, and you can believe it or not believe it, but anybody wants to fly to me, we'll go online. I'll work on you for free. We'll put it on right on video. But it's got to go on video for everybody to see. And bring me a fibroid. You can bring it the big as a cantaloupe, and I will get the fibroid down by about 30% in about an hour. Okay. All right. So let's just get to work. And I've actually brought fibroids, and we call them tumors, down by 40, even 50% in an hour and a half. You heard what I said. So guess what? How many practitioners won't even touch it? Why don't they touch it? Well, because nobody ever thought to touch it before. That's all. It's not because it's right, not because it's wrong. And then you can tell me, well, we don't want to increase the circulation there. Well, what do we want to do? If you don't want to increase the circulation in the area, then how are you ever going to heal it? So it really makes no sense. So when they say, oh, don't want to increase the circulation of cancer, well, you know how you do that? By doing sugar, GMOs, processed foods, prescriptions, okay, and stressing out that you don't have the power to heal. All right. Okay, so we can go on this angle like this and go in and break it up. And you come all the way down as much as you can reach comfortably. Okay? So be creative. And then you can, like I said, you can go over here and hold. And like I said, you're always pulling the skin tight if you can, because you get a better feel. Okay? And you just go in there and play with it. Look it. If you're scared to do this, then just do the top from the kneecap back 2 inches today. And go in there and do it for 20 minutes. And think about it and close your eyes and go, I got this. I am the greatest practitioner in the world. I'm better than that Darrell guy who thinks he's so good. You know, honestly, tell yourself that you are, and you will be. Anybody can do what I do and do it better. You need to understand that. I am nobody special. I'm a guy who just was hungry. I'm a guy who had drive and decided that when he went to school that all the other therapies weren't really helping people. And I didn't get into business for that. Both my parents died of cancer. There's been so much sickness in my family when I was younger that, you know what? I just didn't want to do anything except to help people and stop the pain. So when I became a therapist, I didn't want to keep doing all the therapy that I did. I have a doctorate in acupuncture, and I don't practice that at all now, hardly at all. And I'm not saying acupuncture is not good. I'm just saying we need to empower people, and we need to get to the root cause. All right?
So, Darrell, isn't there another way of working with the knee? We have the shot glass.
Yeah. So we call this one-shot therapy. And we're actually going to be doing a whole video series. That won't be coming out until probably April. It will be coming out, and we can show you how to actually work on your whole body. And we're going to have a whole video series. Every once in a while, we'll get on here, and we'll start showing you some things. But we want to do it right? That's why I said it's not going to take 15 minutes.
Yeah, and the thing is, too, that sometimes people, might feel a little bit awkward using their elbow, or they're not confident with it, or they may not have control. But using this, it's just another approach so that you can work on yourself.
So if you want, you can call us, and we'll sell you like our Muscle Restore in the small bottle that fits in here for the same price as the Muscle Restore. And we'll give you the shot glass. Okay, this is the type of thing that we found that was really good. You just have to hold it like this and listen to this, and you can go in there and just work on yourself. And go in there and break up the crystals. That will give some people more leverage if they can't bend over as much. It gives you more freedom, and you can get in there and you can use the other end as well. Okay, so just go in there and play with it. All right, and you know what? I do Braveheart Nation every Tuesday, and that's when you call me up. That's when I'll talk to you. I'll show you things. I'll answer your questions. Look, We're giving you this stuff for free. We're letting you call in for free because it should be yours. So we'll just take baby steps and just know this. This is not meant for everyone because a lot of people are trained that to become victims. So you can either become the hero of your own story or remain getting treated. And there's nothing wrong with that. If you don't want to take personal action, but you're just not going to get the same results.
Right.
Right?
Right.
So yeah, you can work anywhere, and we'll actually show you how to do the whole body. You can get rid of sinus problems, TMJ problems. We have people that come to us and they think that have lost their hearing chronically over time, and we'll restore the hearing. And we may not restore it 100%, but we'll restore your hearing that you're going, yeah, I love this. And then we'll show you how to work on yourself that you never lose your hearing again.
And keep one in your car. I get stuck in traffic. I'm sitting there and I'm working my neck or I'm working my arm or my TMJ. And it's great. I mean, have one in your bedroom, in the family room, in your car, and you'll have fun.
And we are open for questions. So if anybody is out there and they want to talk or they have a question, please call now. And because we're gonna keep talking here, but we're gonna be wrapping up in a few minutes here. So if you want to hand me the blue one, and then also the tea up there.
Yeah.
Okay.
I love the tea.
Okay. So and then if you can hand me the castor oil pack, great, and the book. We got it all now. Okay.
We have everything.
Yeah. So now that you've done your knee or you're going to do your knee, what you want to do is you want to get cotton or wool flannel, and you see this here. You want to get it that it's 3 layers thick at least, and it could be 4. And you're going to soak down with organic raw castor oil. You're going to soak down the wool flannel or cotton flannel. Wool's better, but don't worry. Cotton's fine too. And why is wool better? It has higher frequency. Okay, so then you'll soak it down, and then you can warm this up if you want, like in the oven, after you've soaked it down. Or you can just soak it down if you don't mind the coolness. And put that around your knee. And then put your heating pad around. And what you want to do is you want to do that every night for 30 days if you've got a knee problem. Well, we'll show other problems later, but let's talk about the knee today. So if you got a knee problem, you want to do it for about an hour every night for 30 days. Okay? Why? Because castor oil draws and pulls, and it actually goes in and heals. All right? So we know that if we can get the more blood flow we get, the softer the beef jerky. Right? So if you keep doing this, it's going to make things more flexible and easier for you to work on. Okay? And the other thing is when you finish up, you want to use DMSO. And there's a lot of them that aren't that good. This one's really good. This is totally non-toxic. When you use DMSO, there's only one thing. You're not going to be picking up chemicals and then or have chemicals in your hand and then put DMSO in your hand and put it on. Because DMSO will absorb whatever you're putting in. So let's say if you had a knee and you had a really bad knee problem, I would use the DMSO, put a little bit, just a little, you only need a little. Mm-hmm. Put the DMSO on, and if the circulation's really bad, then what you're going to do is you're going to take Muscle Restore, and you're going to put the Muscle Restore on it, and it creates all this energy and heat. Oh my gosh. If you guys do this, I mean, come on. Here we go. And now let's say that your knee is in a lot of pain. Okay? Oh, my knee is in a lot of pain. You want to take the DMSO and put that on. And then we have, and I mean this, we have the highest concentration and the highest quality of peppermint in the world. And when you try our peppermint, you've never tasted or seen anything like this. You need very little, and it's explosive with energy. So then you'll take just 3 or 4 drops of peppermint. That's all. And you'll rub that into the DMSO. And that pain, boom. There is no drug. There is no therapy that's going to drop that pain down faster. Okay? So then you can put that peppermint right on and with the DMSO. DMSO you might apply like anywhere from 3 to 4 times a day. It could make your skin dry. So then that's where you use the moringa oil and you put that on. And then you back off of the DMSO a teeny bit, right? Till your skin starts to, it's not hurting yet, so you'll be okay. And then you you can put the moringa on, and you can still keep doing the essential oils. And remember something, it's consistency. Creating the perfect day is what heals anything. You know, people will drop off. So what you want to do is you want to make yourself a little schedule. This is my knee schedule. Dr. Wolfe said if I make a schedule, put it in the bathroom or put it everywhere I need to see it, and I follow that schedule, that I can heal myself. Well, I back it. I'll back it. Yes, you can. You can heal yourself. All right? And the other thing is understand something. You gotta bring down the load. So you want to make sure you're drinking structured water, okay? And you want to be doing our tea. Because the daily cleansing tea works on all the detox organs in the body. And when you lessen the load, you lessen the inflammation, you lessen the scar tissue formation.
Yeah, and that tea is incredible. My clients use it. We go through it like crazy. And it really helps lighten the load. And I have some people that it really changes their urination as well. They're urinating more. They're getting rid of the toxins. Because, we only sometimes think that our colon's just one of those detoxification organs, but our kidneys are too.
And understand something. Yeah, between the tea, if you've got bladder, ovarian, uteral, prostate, or you have an endometriosis, by doing the non-surgical, Wolfe non-surgical technique on that area and doing the tea and creating the perfect day, and go to docofdetoxlibrary.com and read The Perfect Day, and then read The Braveheart Way, and check and read. I've got a couple booklets there, like Inflammation to Scar Tissue, another one that's called Scar Tissue to a Tumor. So check those out, and then you'll understand how the human body operates, and that there's only one operator that can operate that body.
And that's yourself.
Yeah.
And so the other thing, Darrell, I'd like to ask you a question. Regards to the castor oil, because I've seen different things. You can use castor oil anywhere on the body, actually, and it will help draw things through.
Yeah.
So when you use that piece of flannel or wool, how long can you keep it? What do you do after you use it?
Well, you can use it until it starts to turn gray because of the toxins that are being pulled out. Mm-hmm. And you can, or it'll probably start to smell with a lot of people. So if it starts to do that, you can wash it. Mm-hmm. I would just throw it out.
So I've seen...
It's not expensive.
Yeah, well, I've seen some people say when they get done with it, they put it in a plastic bag and they put it in the refrigerator.
Oh, yeah. Oh, you're talking about after each use. Thank you.
Well, there's different ways.
If you go to my Healthy to 100 book, it explains all about the Epsom salt glow. It explains the skin brushing, and it explains the...
explains everything.
Explains everything. The castor oil pack, and it's all back in the skin section. Oh, and if you want, right now, if you want to call in, just pay the shipping and we'll send you out a book. And as far as the tea goes, we'll send you out a 2-week free supply. If you want to try the tea, just pay the shipping. But when you're done with the castor oil pack, why don't you tell them?
Well, what I usually do, I get done with the castor oil pack, is that I have a baggie and I put it in my refrigerator. And then when I bring it out again, I may heat it up. And I have a steamer that I might use. I don't have a microwave in my house. Mm-hmm. So then I can warm that up and then I'll put it back like on my knee. But another thing too, depending what type of heating pad you might have, because sometimes what I'll do is I'll put saran wrap over the cloth and then the heating pad.
Well, we always want to do that.
Yeah.
Because you don't want to get the oil on so you're going to put the castor oil pack on, then the saran wrap around it, and mm-hmm. then you put the heating pad. And then when you're done, if you want, you can wrap it up in the saran wrap, or just put better in a baggie though, because it's going to seal it.
Yep, keeps it.
And then keep it in the fridge because it's oil. You want to keep it fresh.
Right.
Right, but you'll know when it's time to throw it out, and it's better to throw it out sooner than later because the castor oil is actually getting full of your toxins that it's pulling, and the more filled it becomes, the castor oil, the more filled the flannel becomes, and you're not actually drawing.
Yeah.
Okay.
It's a great approach for another tool for detoxification, actually.
Yeah.
So.
And understand something. Detoxification should be lovingly and gently done each and every day. You build in this beautiful I love you protocol instead of this I'm going to pile up the garbage until I'm in so much pain that I have to do this deep cleanse that's just going to take my body down.
And you know what? A lot of times my clients will come to me and they say, well, I'm going to go on this fast. And then when I get home, I'm going to just do this. And I said, be gentle with your body. It's like our love band here. You don't want to snap it like that. You want to do gentle snaps because your body doesn't like to have huge surprises hitting you like this. Gentle kisses, gentle steps moving forward.
And understand something. The level of pain that you're willing to experience is the level that you actually love yourself. But understand, this is on an unconscious level. This is not, you're not like, oh, it looks like people are actually trying to do it to themselves. But everybody does everything they do because they think they're going to create happiness. But we're actually more programmed than we think. And, when you take a look at happy people, it's because they just have a better program than you. They have better beliefs than you do. And the thing that you don't understand is that the beliefs you own are probably not yours anyways. They're probably some systems or your mom and dad's. And God loved my mother and father, but they were so dysfunctional. And I'm sure that if I were to ask any of my kids, they'd say that I am too. So I'm always trying to work on myself because we come down here and we fall, we lose ourselves. But that's the game. And now the game is to find yourself and honor, respect, protect. There's a oath, and I'd like to close with this. Okay? Today and every day, I will create the perfect day where I will totally trust, honor, respect, protect, love myself more than anyone else or anything else. So help me God, because I am, I can, I will, I am healed, I am love, I am Braveheart. And understand something. It's okay. You know what? It's time. It's time for you to focus on you and be selfish enough to know what your needs are so that you can be the guiding light for your family. Would you like to close?
Yeah, well, I would like to close with, I know this has been a real long segment, but I would like to invite you all to go to ITIOH and look at the courses that we have coming up in Florida, in Kelowna, Australia. Look there, and if you have questions, then just call the clinic here. Anybody here would be happy to talk to you. And if you haven't gotten on into the Braveheart online course, I really encourage you to do that. That is such a great prerequisite
and right
to
now
coming
it's
to the life coach.
$197, and you can invite a Braveheart buddy, so it comes down to around $90-some. And guess what? This is about you going through a 38-hour course at your own convenience. You've got all kinds of quizzes in there. You've got me talking and guiding you. And then you can come on the Braveheart every week and ask me questions and understand something. The Braveheart never will continually change. Am I right or wrong?
That's right.
I redo the manuals every few months, and I reshoot different acts when I find things better. And I've been at this for 38 years. I've done 25,000 emotional consultations on people.
And you know what? We have a bonus for those people in Florida that are massage therapists. I got the online course approved for CEUs.
Yes, and whenever you take any of our courses or come for our personal treatment and training as a couple or with your caretaker or you're just coming for treatment, I give you the Braveheart online course for free. And just know this, that when you get hooked up with us, you stay hooked with us until we can get you to find that perfect day for the perfect life.
Absolutely.
Okay?
So come join us. God bless you.
And we'll see you in Florida in October.
Have the best day ever and weekend.
God bless.
God bless.